Hi, it's Tonya from Star for Brooklyn. So we are doing a number of videos to provide information about the coronavirus, what it is, and how to stay safe and healthy during this pandemic. All right, so this is the short version. So what is coronavirus? Coronavirus is a class of viruses that basically cause respiratory illness. Some respiratory illnesses or some coronaviruses can be really mild, like a common cold, and others can be more severe, like SARS. The thing that they all have in common is that they create respiratory illnesses and extreme respiratory distress for those that are serious. So why is it called COVID-19? I know it's like, what's this name about? So COVID is kind of, if you want to think about it, it's like a short nickname for coronavirus. And 19 is tagged on as the broader nickname for this coronavirus because it was discovered in 2019, in December 2019 in China. So what is really important as we just quickly get through this is for you to understand that COVID-19 coronavirus is highly contagious. It is spreading rapidly through our community. We have what is called community spread. We're like, it's going on and we don't even know, okay? So I know a lot of people are also confused, like, is it like the flu? You know, what is it? You know, it's just like the flu. It's not like the flu. Here's a list of some similarities and differences. You know, yes, it can cause a fever and cough just like the flu. A lot of people die from the flu. It spreads the same way through these respiratory droplets. It's kind of gross to think about it, but like when people are coughing little things of water traveling in the air and going into your mouth. They can be prevented with the same methods: washing their hands, covering your cough, social distancing, cleaning, keeping your area clean. And, you know, just like the flu, they can be contagious before symptoms show. But what is different with the coronavirus is we have no experience with this. We have no immunity to this particular virus. With the flu, we've had over 500 years, but with this, we don't. There is no vaccine. I know that people are talking about vaccines being developed, but it takes a long time for vaccines to get to people. It's a long, complicated process in science and testing and making sure that it is indeed a safe product. And we're not gonna have a magic bullet like that. It would be lovely, but in the meantime, we have to do what we need to do now to keep people safe. The flu happens every year. We don't know if this is going to be returning or not. Some new evidence today is suggesting that people can be reinfected, that maybe it's not going to be affected by the warmer weather that's coming, which means that we're going to have this for a while. The incubation period for the flu is shorter. It's about 5 to 7 days, whereas with the coronavirus, it could be longer. And this is the most scary thing, is that the number of people who do not survive the coronavirus compared to the flu is profoundly higher. So we are going to, if we do not work now, we're going to lose a lot of people. So here are some symptoms. Indeed, you know, like mild symptoms could include like a sore throat. People with respiratory things, often it starts in our throat and we need to keep it moist. We need to be drinking lots of liquids. Room temperature is best as opposed to like cold water. We might get a runny nose, sneezing, aches and pains, a headache, but this is also flu season. This is also like allergy cold season. So you need to be mindful, like this is a minor symptom. Let me stay home and watch this. The more severe symptoms include having a fever of over 100.4, having a cough, shortness of breath, or pneumonia. If you've ever had pneumonia, you might know what that feels like. These are considered sort of the severe symptoms, okay? Some of them might be manageable at home and some might not be, okay? And these symptoms can start from 2 days after exposure up to 14 days. I think on the average, they're saying about 5. Again, going back to, is this something else or whatever, think about the fact that there are a lot of overlaps with other um, illnesses, flus, and colds at this particular moment. And it's not, um, you should not be alarmed if you have some of these minor symptoms, because as the coronavirus is spreading around, so are other just regular colds. For example, I've had a cold for 3 weeks. It was a sinus cold, and then it turned into a respiratory infection, which means that I need to stay in my house because now I am particularly vulnerable. But in terms of the coronavirus, some real telltale signs is like, have you had contact with someone who then later told you that they had COVID-19? Have you been traveling or in contact with people who've been doing traveling, international traveling? Do you have shortness of breath? Like, is it a labor for you to breathe? Okay, these are serious. I just want to remind people, Christmas, let me move my picture up here, that 80% of those with COVID-19 are going to have mild and moderate symptoms and are going to recover, okay? 80% of the people who get the coronavirus are going to have mild and moderate symptoms and recover. And you should do that at home, okay? But I want to talk about the 20% of people who are most at risk for bad outcomes. So let's just go back a little bit and just talk about how it's spread. Again, it's spread person to person. This is like people you have close contact with, closer than 6 feet. These respiratory droplets floating in the air, and sneezes and coughs. So remember, cover your cough, not with your hand, with a tissue or with your elbow, the chicken wing. And if you're using a tissue, put it in the trash. And these go right to the lungs, and that's how we get it. Yes, can someone who looks healthy spread the coronavirus without being sick? Absolutely. But if you do encounter someone who is sick, whether you know it's coronavirus or not, just assume it's coronavirus. That is the time where they are most contagious. So please stay away from sick people. Sounds horrible, doesn't it? So who's most at risk? Unfortunately, our healthcare workers, who are incredible people. I want to send mad props out to all of my colleagues at SUNY Downstate in the emergency department, and the folks at Kings County Hospital as well, the infectious disease doctors, et cetera, the nurses, the PAs, everybody. They are our heroes, as well as our first responders, police, firemen, et cetera. They are most at risk because they are seeing far more cases and exposure to this virus. But in addition, there are other vulnerable groups, and we need to talk about that. We need to talk about that this virus really targets the immune system. And when we reach the age of 65, that's when our immune system naturally starts to wane or to decline a little bit. It's not immediate, it doesn't go like a cliff, but it starts to decline. That's why we're seeing people who are 65 and older are most vulnerable. Folks who have any chronic medical condition that includes heart disease, lung disease, COPD, asthma, which I didn't realize was a serious lung disease. I have it. I've had it my entire life. My mother helped me to not freak out about it as a child and made me think that it was not a big deal. But the truth is, I happen to be one of those people that has serious asthma. I was even hospitalized when I was at college because my asthma was so serious. For people who are immune compromised, and this is people who've had cancer or have cancer right now or doing cancer treatments, people living with HIV or other autoimmune diseases. People who have diabetes and hypertension are also at risk. And folks who are smoking, you really, 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 really need to stop smoking. And if you're vaping, that increases your risk. Okay, so emergency. When do you need to check in with professionals? So before you just jump up and go to the emergency room, these are the most important emergency warning signs. If you literally are gasping for breath, you cannot breathe, it is a labor to try to breathe, you need to call for help. Persistent pain and pressure in your chest. If you're having some sort of confusion, like you're kind of not able to focus, you're unable to stay sort of awake, or something that's sort of cognitive in terms of confusion, that's a big thing. And if you have bluish lips or any bluing in the face, you need to get medical attention ASAP. You need to, when you call 911, you need to let them know that you suspect that you have COVID symptoms or that you have the coronavirus. You need to try to cover your mouth to protect the healthcare workers. If you don't have a mask, put a bandana or a scarf around your mouth so that you will not hurt others who are trying to help you. And again, I just want to remind people, because I know that there's a lot of fear and anxiety, and people with sniffles are running to the emergency room. Please do not go to our emergency room. Our emergency room is really only for people who are severely sick. At this particular moment, there's no testing. We're not just doing testing because I just want to know if I have the coronavirus. Testing is only going to be used to determine if indeed that is the problem, and to help the doctors figure out treatment. So we need to stop thinking about testing. We need to think about, if you're sick, whether it's a regular cold or the coronavirus, you need to stay home. Most of us are going to have mild and moderate symptoms, and we can take care of that at home. This is the NYC coronavirus hotline, 1-888-364-3065. Please call that. Again, here at Star for Brooklyn, we are trying to use this platform to try to disseminate information. So please, subscribe to us on, whether it's on Facebook, on Twitter, on Instagram. We're also on YouTube. Please, please, please figure out a way to stay in touch with us, okay, so that we can continue to share good information with you. As always, please take care and stay healthy and stay safe. Thank you.